Hello, my name is Fiona McDougall and I'm one of the physiotherapists here at the Western General Hospital. I'm going to talk to you today about hip replacements. Hip replacement surgery is one of the most common and most successful operations done in the UK. When you get arthritis, the hip joint wears away. When you have your hip replacement, the damaged bone is removed and then a metal and plastic or ceramic joint is put in its place. Here is a model of the normal hip. Here's one with an arthritic hip, and here's one with the new ball and socket joint. So this one represents the normal hip joint where everything is lovely and smooth. Exercising before your surgery can really improve the speed of your recovery. Start from today, and the stronger you get your muscles before the surgery, the easier it will be to get back in shape afterwards. We recommend that you do these exercises 4 times a day, doing each exercise 10 times. Okay, so the first exercise we do on the chair is briskly moving your ankles up and down. You can do this when sitting, and you can also do it on the bed with both feet. Briskly move your ankles up and down to get the circulation going and get the blood moving through the muscles. This is a very good warm-up exercise. For your second chair exercise, pull your foot back towards you, straighten that leg out as straight as you can, hold it tight, count to 5, and then slowly lower back down. This builds up what we call the quadriceps muscles, which are the big muscles on the front of your thigh. It's also good to do this on your other leg. If both legs are strong, it's much easier to get walking after your surgery. Next, to the bar. You can use the kitchen work surface or the back of a steady chair. Just lift the leg you've had operated on, up and down gently. We don't want this hip to go beyond 90 degrees after your surgery, but I'd be surprised at this stage if you could actually manage to lift your hip that far. Just 10 times up and down like this, which is working the strong muscles at the front of your hip joint. The next exercise is again holding onto something steady, like the kitchen work surface or the back of a steady chair. Just lift the leg you've had operated on gently out to the side and down. You're not trying to get a massive distance, just a short distance out to the side and down. Keeping your foot pointing straight and your toes pointing forwards. Also keeping your back straight and avoiding twisting that leg. So we're just building up the strong muscles on the side of your hip. Once you've done, repeat 10 times. And the last exercise, again holding on to something solid. This time, lift the leg you've had operated on to the back and down. Keep your back nice and straight as well. People tend to dip forwards, but just keeping your back nice and tall will help make it easier to do the exercise. This is not for AMIS hips. We'll go into a little bit of detail in a minute about what an AMIS hip is. So most hip replacements we do are either done from the side or from the back, but there is a different sort of hip replacement which is called an AMIS hip replacement, which goes in from the front. Thank you for watching. I hope you find this information useful. There'll be a little bit of difference depending where you have your surgery, but this gives you a general introduction.